And welcome to Sugar Talk with Dr. K.G. Lucas from Diabetes and Endocrinology Consultants. Good morning, doctor. How are you?
Good morning. I'm great.
And what are we talking about today?
The thyroid, part two.
Part two of the thyroid. You brought your prop again with you today?
Yes, the thyroid. We showed it last time.
Yeah.
Thyroid sits in your neck, unobtrusive. You usually don't see it. But if there's a thyroid problem, you might start seeing it. And we're going to talk about hypothyroidism. And hypo means low thyroid. So what causes a low thyroid? Everybody thinks they have a low thyroid because they're tired. The most common reason you're tired is because you don't sleep well at night, or you don't sleep enough at night. But anyway, the thyroid does regulate your metabolic rate and how fast you do things. So if your thyroid is low, if you're not making enough thyroid hormone, then you usually are tired. It's more sleepy, tired, falling asleep, sleeping a long time at night, cold because you're not generating heat from your body, so you're colder. Usually your hair is thinner or falling out, skin's dry, everything's just slowed down, constipation, muscle cramps, so you just don't feel good, you feel sluggish, and that's could be a sign of low thyroid, but those are vague symptoms, so you may have other things wrong. It doesn't have to be thyroid, but thyroid should be investigated.
Is that a regular check? Is that something that we usually get checked?
Some people do, but I don't think everyone does it like a yearly check. It's part of some chemistry panels for some doctors, but it's not usual. And the usual test is the TSH. That's the screening test. That's the pituitary hormone that controls the thyroid stimulating hormone. So it's a sensor that tells you whether you're getting enough or not. So any little slight decrease, even if it's in the normal range still, but the normal range has gone, your level has gone down for you, the TSH will start going up. So it's a better test than just the T4, which is the thyroid hormone, because we don't know what your T4 was, and now it still might be in the normal range, but the TSH goes up indicating that you need more.
So if you exhibit, though, these symptoms, is that something you should ask for the next time you have a physical?
Yes, I think anybody that's tired, a lot of women go through menopause, the thyroid will act up then. And then during pregnancy, they suggest doing it. So it's very important, and it's more common in women, and tired women should have a TSH.
Okay, all right, good. So, but what causes it to just stop working?
Some people are born without a thyroid. That's
Really?
why they check newborns for T4 or thyroid hormone because it's very important for brain development. So if you have enough thyroid hormone, that's good. But if you don't, you need to have it replaced early. Then the most common reason is that you have an autoimmune disease, which is called Hashimoto's thyroiditis.
Okay, as long as you
named
can
after
say
the
that.
Japanese guy that described it. But it's when antibodies attack your thyroid and kill it. And you can measure the antibodies in the blood, but it causes the thyroid to not work. Over time, it gets scarred up. Sometimes it makes it bigger, so we have a little prop here. So this is the normal thyroid here.
Right.
Let me see that.
Okay.
So
All right.
hold this up.
You can see this later on YouTube.
You can see this. Hold up to the microphone. So that's the normal thyroid. But Hashimoto's sometimes can get bigger.
Oh, yeah, quite a bit.
I can't even put it in your neck. Okay, so it's bigger.
That's, Mr. Potato Head doesn't come with that, does it?
Man. Okay, so it's so big it may stick out. And if you swallow, you may see a big U-shaped thing sticking out. Or it may feel firm to touch. If somebody examines your thyroid and they actually feel it, then it's a little bit big. But if it feels firm to touch, it may be because you have antibodies attacking it and it's scarring it up. And that's why sometimes it's bigger, because it's trying to work. It's trying to get bigger to work, but it can't because the antibodies are attacking it and keeping it from working properly.
So what do you do about that? I mean, is there drugs to reverse that, or you just remove it?
You can't prevent the antibodies. There's no drug that gets rid of the antibodies. Antibodies are set off by various things, such as at the end of pregnancy, sometimes the antibodies go wild. Sometimes stressful events cause the antibodies. Sometimes viral infections cause it. But you can't get rid of the antibodies without getting rid of all your antibodies in your whole body, so that's not a good idea. So what you do is, as the thyroid gradually dies off, you try to replace what you need. So you take thyroid hormone. And thyroid hormone like Synthroid or Levoxyl, those are brand name thyroid hormones, are converted by the liver into the active form. So you take T4, the liver converts it to T3, and T3 is the one that does all the work.
Have you ever done thyroid studies? Have you ever done them? Drug studies?
Not usually, because thyroid's pretty boring as far as medications. The things now are thyroid cancer. They're developing new things for thyroid cancer, but we've never done any thyroid studies. Yeah, we don't have any research studies on that because it's pretty well like, you know what to do with it. The drugs are pretty fixed.
So how is this connected? I think we went over this some last week, but how is this connected to diabetes?
Well, diabetic patients tend to get more thyroid disease. About half of people with type 1 get thyroid disease, and that's because type 1 diabetes, which is the insulin-dependent kind, is autoimmune. It's an autoimmune disease that kills the cells in the pancreas. So people with one autoimmune disease tend to get other ones, and that's when the thyroid comes along, is that about half of them get antibodies to the thyroid as well.
Okay. All right. We'll take a break. We'll come back with more with Dr. K. Lucas on Sugar Talk from Diabetes and Endocrinology Consultants. Hey, welcome back to Sugar Talk with Dr. K. Lucas from Diabetes and Endocrinology Consultants. Your calls are welcome at 800-818-2255 or our local numbers.
247-7282 or 353-4674.
So when your thyroid isn't acting enough, it's underperforming. That's hypothyroid.
Hypo.
And then next week we're going to talk about hyperthyroid.
Hyper. Everybody thinks they want to be hyper, but that's not really true. It's not a good thing.
All right. Well, let's talk a little bit about your schools that are coming up too, and some of your tests that you have going on. Your next diabetes school.
June 4th, so it's coming up on a Saturday. It's in New Bern this time at the Doubletree. And we'll talk about what diabetes is and how you treat it and all the different drugs. And we have a dietitian coming to talk about what you should eat and what you shouldn't eat and how much of what you should eat.
Yes, that's right. And you have, again, with these new audiences, really. I mean, I imagine some folks are coming and that you've seen before, but in these new places, new audiences, it's pretty exciting to see these new people.
Yeah, I think it's a lot more convenient for people to come, and it's a better setting sometimes.
Okay.
We had a good time in Swansboro.
All right.
It there.
So if people want to come to the June 4th in the Doubletree in New Bern, how do they sign up for that?
They just go to the website, beachdoctor.com, and sign up. There's a sign-up sheet in the front, or a link to the sign-up sheet. So they can sign up. They can always call the office and get put on the list.
Okay. And you have some studies going on now, too? You want to tell us?
Yeah, we have a couple of type 1 studies, one using another kind of insulin and one using pills for type 1. Not getting rid of insulin, but adding to the insulin to help the insulin work better. So those are type 1 studies for people on insulin pumps, or insulin shots. Type 2 studies involve people only on metformin. So if you're on metformin and your sugar is not well controlled, then we have about 3 studies for that. If you're on Victoza or Byetta and metformin, or another injectable that's not insulin with metformin, there's another study coming up for that. And anybody with diabetic kidney disease or heart disease, we have studies for that. So we have quite a variety of studies to choose from.
Is this relatively new in medicine to start studying the ones that will help out in other medicines? You know, you're already taking one, but maybe you could get better results if you added another medicine.
Yeah, and there's about 300 genetic defects that cause type 2 diabetes, so it'd be nice to know what genetic defect you have. There's no test for that. They think they're going to come up with tests for that, but I'm not sure that's cost effective. But trial and error method has worked very well for a long time, and it makes some sense. So you're treating an underlying problem. So if you're insulin resistant or you're overweight, you want drugs that help you lose weight as well as control your diabetes. So you sort of tailor the treatment to the patient, and different patients need different treatments. I mean, you have to individualize therapy, and there's a lot more choices now with drugs, and that's what all the research studies are, is finding new drugs and better drugs that treat a lot of things, not just the diabetes.
So when we see the ads on TV that talk about, if you're not happy with this, and or maybe it's underperforming for you, you might add this, and maybe a variety of different disorders.
Yeah, the ads are a problem in a way because it just tells all the negative things that a medicine could cause. It just it talks about the side effects. It doesn't talk about, you know, what'll happen if you don't take it.
Right, right.
So it only talks about everything, and it doesn't really tell you what your risk of that side effect is. You know, whether it's 1 in 10 or 1 in a million. They just list all of them equally, and it really skews the data. and the FDA requires that, but it doesn't. That is not good information.
I want to find out more about these studies and also about the next class you can take too. You can go to beachdoctor.com.